The project, it's a mental health football project for people with serious mental illness. It's mostly men, but there are women too. There is a charity called Rethink Mental Illness who came up with a campaign called 20 Years Too Soon. And people with serious mental illness a longevity at 20 years less than the general population. And there's all sorts of reasons for that. One of the issues is around physical activity, about isolation at home. It's about people not feeling connected with their society and suffering physical illness as a result of that withdrawal. So it's finding new ways and innovative ways of reaching out to people so that they can connect with each other, they can develop that camaraderie, and they can develop skills that they perhaps didn't even think that they had, and even go on to such things like work and such like to relieve any poverty and such like. So it goes much wider than the physical activity. That's important, but it's the whole social environment around it. The impact, I think it's maybe sometimes in the first time that people sort of feel empowered to take control of their own mental health and their own treatment. And this isn't something that we're giving to people. This is something that people are participating in, and they're also developing themselves. And people come onto our steering group, service users. Service users have ideas of how to develop the group, and the whole push came from service users saying we want to play more games, we want to get into a league, and we're kind of running to keep up. And people don't run to their psychiatrists and say, I want more medication, but they want this. And I think it's that kind of fervour that we're picking up on from the patients themselves.
Yeah, people have got jobs through this and gone out to improve their lives. That's what it's about, really. So, yeah.
Well, we've come quite a long way. I mean, we're now playing in a league. We've made partnerships with a local football club. Sheffield United are providing coaching staff, and they're fantastic, and it's a great motivator. The FA are providing courses for people. They're paying for courses, for referee courses, coaching courses for service users. And really would like to widen that out, and certainly a women's team will be the next thing. And we're also talking about developing a CAMS team for children and adolescent mental health. So I think it's expanding, but we need to grow at a rate that we feel we're able to manage. But we feel we've come a long way so far, and we'll consolidate this and then move to those other areas. It's the first bit of silverware that we've won.
The football's not great. No, we're getting there. But it's just the appreciation of what we're doing.
It's fantastic.
And watching the patients grow and developing their lives is what we, more than anything else, is that. Yeah. But really, I would say.
And it's, I mean, this is going to mean such a lot to the patients when we go back and say, we came to Leeds, we explained what we did, and they liked it so much that they gave us this.
Yeah,
and it's going to make such a difference.
It's great. Yeah. It's really good.
Yeah. Yeah, and I think it's all the partnerships. It's the partnerships with the service users, partnership with the trust, with the local football club, with Sheffield United, with the FA, with our research partners who have done some research and drawn out the benefits that people feel, the wider benefits. So it's the Sheffield University researcher, Dr. Liz Such, has really led on a lot of this, just encapsulating and crystallising what it is that happens in our group, if you like, that we notice, but she's able to articulate it. And so I think, having something like this really sort of reflects the hard work that she's done.
There's a lot of people in the background involved. And it's developed great, which is fantastic.
Yeah.